Hello, my dear friends. I'm back with another case. This case came to me, and obviously, there is a lesion, there is interdental bone loss, there is under obturation, and I removed the crown. Patient was wanted to save the tooth. Of course, at the beginning, you have to assess the difficulty level of this case. This mostly looks like an entomolaris because you can see that the two GPs are very far. If you want to confirm, you can take slightly more horizontally angulated X-ray so that you can reconfirm it. And then I was more worried about the interdental bone loss, less worried about the distal lesion because the distal lesion, what you see, can always be healed with calcium hydroxide, or it may heal with proper obturation. But I am more worried about this area where you see that there is a interdental bone loss, and since it was a retreatment case, I wanted to be double sure that there is no perforation. So, but yes, always it is better to do at the beginning because many times cases may be asymptomatic, and when you start the case they suddenly become symptomatic, and it is a general tendency for the patient to believe that it has become symptomatic because of your treatment, but it is basically because of the flare-up. So here I advise CBCT, and in CBCT it is diagnosed as endoperio lesion, but there is no perforation. So you can see the post-operative X-ray. I have done a temporary restoration for now, and in this X-ray you can clearly see that it was a case of entomolaris. I have done a 4% enlargement in the apical portion, and in the top portion, especially entomolaris area, you can use a Orify shaper or a 6%, do a progressive shaping with 4% and 6%. And then just obturate. The GP here is removed with just by mechanical instrumentation. I use NeoEndoFlex files for removing the GP. You can use the solvent, but this case is more about, in fact all the cases are more about how you can achieve patency, open up calcification by using a hand file, and then the rotary will just follow it. So in retreatment, always explain the positive, negative sides of treatment at the beginning. Always make sure you tell the patient that you are trying to improve the treatment which is done by the earlier dentist, and there is no guarantee that the case will succeed. But if you are skilled, you also have an idea whether it is possible or how much maybe it is worth taking a chance. So I have obturated it. I plan to give a temporary crown for maybe a 15-20 days, and if the case heals properly, I will start going to a permanent restoration.